Money FM 89.3, the best of the afternoon update. Viewpoint.
Money FM 89.3. By 2026, Singapore will officially be a super-aged society with more than 1 in 5 Singaporeans over the age of 65. For many of us, that reality already hits close to home. We're either caring for aging parents or thinking about our own later years. At this year's National Day rally, Prime Minister Wong announced a bold new initiative, Age Well Neighbourhoods. The idea is simple but powerful. Bring more healthcare, activity centres and home-based services right into our HDB estates so seniors can stay healthy, connected and supported where they already live. It raises an important question. What does it really take to design a neighbourhood where people can age well? Is it just about more clinics and activity centres? Or is it something deeper about how we live together as a society? Joining me today is someone who has spent decades at the front line of elder care in Singapore, Dr Ng Wai Chong, CEO of NWC Longevity Practice, which provides aged care consultancy and professional training. He's also the Director of Clinical Development at the Home Nursing Foundation. Dr Ng, welcome to Money FM 89.3.
Thank you, Lynlee, for having me.
Now, Singapore is projected to become super aged by next year, as I mentioned earlier, with over 21% of our population above 65. So from your perspective, what are the biggest challenges seniors face when it comes to aging well?
Well, because of the biology of aging, all of us will have some kind of declining health reserve as we age. But of course, we can, like what PM talked about, the extension of health span. If you can do enough exercises and the appropriate amount of exercises and the right exercises, you have a healthy diet, and you do your regular health checks and vaccination and keep yourself connected with others and manage your stress, you can actually have an extended health span. So health is really the most important. But of course, there are many other things: income security, connectedness, and lifelong learning, and of course, our inner peace and resilience, well-being, and all that. These are all very important for healthy aging.
So I see it as health is the number one challenge, and then loneliness would be a big one too?
Yes, especially with the changing of the social structure, smaller family sizes, and children living apart or even overseas. So we are seeing more and more seniors living on their own. So, well, living on their own doesn't mean you are lonely. It's just that you are maybe less connected. And if you well, that's a risk of loneliness, probably. Yeah. So loneliness is an important health risk by itself.
I read somewhere that loneliness is as harmful as smoking 15 cigarettes a day. Is that true?
Yes, that's from United Kingdom. That's quite a time ago that they've been talking about that. Yeah, but it's important to note that living alone doesn't mean one is lonely. Yeah.
Okay. And now we see the Age Well neighbourhoods being rolled out starting in Toa Payoh. Yeah. Do you see this as a meaningful response to those challenges?
Oh, definitely. Well, to age well, it's not just about having clinics all around. We need to be connected. There's this socialization, and then everybody needs to have accessibility, to have access to useful services, not just health services. I mean, to live is not just health, it's also your food and your transaction with the banks, with the government, with the CPF board and all that. So to really be age friendly, we need to design our living space with what in mind that people age and the impact of aging on humans. So with that in mind, then we can actually make our living space really age friendly.
I do think it is a step in the right direction. It shifts care from hospitals to the community. And Toa Payoh is really a good starting point because it has one of the highest senior populations.
Yeah.
So the government
is in Toa Payoh Home Nursing Foundation.
Oh, I see. Okay.
Yeah.
Good to know. Now, the government has shared some concrete features, more active aging centres within walking distance, home-based services like laundry and meal delivery, even community health posts staffed by nurses or follow-up care. So when you hear all that, which features do you think will make the biggest impact?
I think all of them are really useful, but it is how do you, it's a process, you know. Actually, when I think about designing age friendliness, it's process, people, places, infrastructure. So what we are just talking about are infrastructures, but how do you do that? How do you engage? You can set up many active aging centers, but maybe they're not attractive, or that the things that you do is it doesn't align with the people living there, and so maybe the coffee shops are naturally occurring active aging centers already. So it's how you design the programs and what kind of people you hire, and how do you understand the needs of the people living in the community, and then that's when you can design appropriate services and programs, and how do you engage the seniors. So the process is really important, and the people you hire.
Okay, interesting that you mentioned that the coffee shops can actually be an active aging centers.
They are already.
Yeah. Okay, they are already. Okay.
Yes. You can come to HDB Hub Basement 1 in the mornings, like 10 a.m., 11 a.m., after the breakfast crowd and before the lunch crowd. It's an active aging center.
Wow. Okay. Okay. I suppose it gives people daily reasons to get out of the house, right? To go to the kopitiam and be with their friends and
Yes.
yeah, socialize.
Socialize, yes.
So the health posts, I think, are a game changer. Seniors can get medication management and follow-ups without, making long trips to clinics.
Yes.
Your thoughts?
Well, it can be a game changer if you know how to manage it. So the community health posts are manned usually by nurses, but in the community, healthcare workers, especially doctors and nurses, you need to think beyond your usual traditional training in healthcare, because a big bulk of health is social and psychological determinants. And typically, nurses and doctors are not well versed or well trained in it. Of course, it depends on which doctors and which nurses are you talking about. They can be good and can be well trained, but frequently not emphasized enough. So if the community health post is manned by nurses, but they're also supported by psychosocial professionals such as social workers, it'll be even better. So I understand that the active aging centers is more associated with the social side of the house, and the community health post is really more the healthcare side. But if both can integrate well together, using the same language of understanding and having the same principles and values of care, I think that will really be a game changer. Yeah.
Dr. Ng, for many of our listeners in their 40s and 50s, the so-called sandwich generation, which I belong to, the promise of coordinated home-based services sounds like a huge relief.
Yes, there's a trajectory of aging. Many of us, of course, we're active and we're aging, like now in my mid to late 50s. I mean, I don't see myself as a senior, but maybe I will still feel the same when I'm in my 70s. But even as I grow older and older, definitely something will give and will become less and less independent. And that's when we have to consider long-term care. So it is not black and white. It's a very it's a very gradual shift from being active to someone who is frail. So we need to have the awareness and some kind of process to capture the point in time when somebody needs a bit more help. And that's when you can provide care. Home care is cost intensive. So we try to use the community resources, the senior access it themselves. But you have to be available when they no longer can come to you. And sometimes it's because of motivation. Sometimes it's too much of a chore and you need to be accessible to them still. Even providing home care. Yeah. Actually, caregivers, many of us in our youth, when our parents are aging, we do not understand what does it mean to be a caregiver. Sometimes we don't really have role models, because when our parents are younger, taking care of their grandparents, the living environment and maybe the society was different. So and now with technology, with even broader services available in the community, is really different now. So I think caregivers themselves need to be supported and oriented to caregiving, and then they know that they're not alone. And some of them, because caregivers are also very heterogeneous, some of them have to balance their own family or their work.
That's right.
And many of them have got different kind of resilience status. So we need to also have some kind of understanding of the needs of individual caregiver.
So from your perspective, how much difference could this really make for caregivers?
Well, it makes a huge difference. I mean, caregiving is very broad and heterogeneous, like whether the care recipient has dementia, mental health issue, disability, and how disabled is this person and how's the relationship between all this. So there are many things that can make a difference. Depends on what's the need of the day. Having a foreign domestic worker helps, but if you don't have a foreign domestic worker, then you need like a coach, a consultant, a mentor. And I think currently I understand that we are transforming our sector whereby every neighborhood having this active aging center. But what's more important is that the active aging center plays a role of like an aged care concierge, whereby if you have a aged care issue at home, you don't know where to turn to. Please don't go to the emergency department. Come to the active aging center, and perhaps we are developing this. I can't say we're ready yet, but hopefully one day the AAC will sit you down and analyze the issue and then focus on the priorities and create a care plan for you after a comprehensive assessment.
Dr. Ng, we've also heard about new types of programs from kickboxing, cardio drumming to carpentry workshops. Are these more symbolic or can they genuinely help seniors?
Okay, I think any kinds of exercise, not any kind. There are four main kinds of exercise: cardio, strength training, coordination, and balancing. All these are all very important, but it cannot be just doing exercise for exercise sake. You need to do some kind of sports and make it fun, like a play. Play is important for mental well-being. So you have to design and it cannot be just kickboxing for everyone. Not everybody will take to that. Some people prefer Tai Chi. Some people prefer just simple walks in the park. So you need to create different kinds of it. So but the main thing is that you have to make exercise accessible, attractive, and cool. And and now with the incentivization system where you can get NTUC voucher, that is really useful.
Okay. Accessible, attractive, and cool. Okay.
Yes.
All right. I suppose it also helps fight stereotypes about aging, that seniors can be active, right? Creative as well as adventurous, I suppose.
Yeah. So actually, sometimes when you think of seniors, we ourselves are senior to people who are junior to us.
That's
so all
right.
of us are really just along the same trajectory. So all of us, I mean, if you think about seniors, you think about 75, 80, and then what do they want? Actually, just think about yourself. What would you want, So
right.
all of us still want to contribute. Like all of us doesn't want to feel like we're old and marginalized. We like to continue perhaps to contribute with pay or contribute without pay, as in volunteering or family sort of supporting our younger generation. So these are actually, whatever age we are, we have the same needs and wants.
Too true. Now, that's the new showcase side. What about older estates? Retrofitting them may be quite tough?
Well, older estates has their own advantages. Older estates tend to have strong human bonds. So this you can't replicate it so easily. So those are something that we need to make use of. Then of course, you can then use design method to design the older estate to be more age-friendly. I understand since 2011, the government has been doing a lot of work in creating this city for all ages where, like for example, I used to work in Whampoa. They broadened the road divider so that the seniors cross the road in parts, halfway and then another half. So it was safer. And also, you make the pavement more wheelchair friendly, and you frequently survey for potholes and disrepair, and then you make amends. And the hawker centers and the coffee shops, these are really important hangouts for seniors. So you, so make use of whatever is available and think of how would an aged person use that place, and then you design accordingly. Even for older estate, it's the same.
Okay. Now, community care apartments, that's another model. But are those limited and require seniors to move?
Well, I think it's a really good idea. Actually, if every estate could have a community care apartment, and if seniors become really needs a bit more services or more care, well, it's not like it's between your home and a nursing home. There's nothing in between. So if there could be something in between, such as a community care apartment, which is good because it is still within the HDB heartland. There's intergenerational connectivity. There's still the familiar coffee shop that you used to. Like, for example, if you're living in Queenstown and there should be a CCA within Queenstown, so you just move to the next block and then you live there. And then your old house is still within your sight. You can still reminisce and you're not totally transplanted to a different estate. So CCA is really good for people to age. And if only, I've got one suggestion that maybe the government could consider. Maybe there could be one level or two levels of CCA for temporary housing, whereby people who need a bit more care immediately after the hospitalization or the hip fracture, they can move in for a short while. And then when they get better, they move back to their own flat. But it's all within the same neighborhood. Then if they really cannot move back, then they stay in the CCA. Yeah.
Very good idea.
Yeah. Temporary beds and housing.
Very good idea indeed, I think.
Yeah.
Now, with all these new services, Doctor, nurses in the estates, home-based care, more centers, is sustainability a concern?
Well, somebody has to pay. These are all important. Infrastructure, housing, these are all costly. Land cost is really huge. Manpower cost is really huge. Although we hire a lot of foreign workers, it's actually developing countries subsidizing developed countries, So all these are really costly. And how do we make it sustainable? I'm sure the basic principles are there. You need to use technology. You need to raise productivity. And then you need to distribute the responsibility that is not totally burdened on the family or on the society, as in the taxpayers, and also not totally on them individuals. So all of us need to sort of share this idea. So that is how I think you make it sustainable, even as a country age. Aging is expensive. I think most countries haven't quite figured out how to pay for their own aging population. The health needs is rising. And it's not just the the medical health, but it's also care. The cost is going to go up. And the expectations, and on top of that, the innovations. Innovation is costly as well. So, but of course, innovation can lower costs if it can be really widely accessible. But in the course of becoming more affordable, it is expensive. So it's a problem. It's difficult to really resolve this conundrum. Yeah.
Any ideas in the works?
Well, I think Singapore is on the right track. We emphasize health promotion and individuals' responsibility. We focus on designing, creating age-friendly environment where people are less isolated, less marginalized, less at risk of having a fall. All these will, of course, contribute towards cost saving. And this emphasis on primary care, the Healthy SG is about health promotion, but it's more than that. It's about being empaneled with a primary care doctor. When you have a doctor who has been built, who has have a relationship with you that you're more comfortable to talk to, and your medicine become a bit more customized, more person-centric. And then you have less chance of over-servicing, over-treatment, or under-servicing, under-treatment. That will happen if you see different doctors every time and see different specialists. And as a specialist who don't understand you or the full picture, because I don't have record of everything, I may just do the safest and most evidence-based, blameless thing that I can do, which is do everything that's available. So, I'm putting this in a very stark way, but it doesn't have to be like this. But what can really improve on this is making our healthcare system a bit more person-centric, a bit more rational, in the sense that the most well-trained person at the lowest cost should be the most appropriately trained person at the lowest cost should be the one handling. So what can be done by a nurse shouldn't be done by a doctor. What can be done by a primary care doctor shouldn't be done by a specialist in the hospital. So I think we are on the right track with regards to healthcare resourcing. And then the community engagement, designing, using volunteers, using self-responsibilities, all these are on the right track. Yeah.
Wow, listening to you, I just know that you have such a wealth of experience. Could you tell me, how did you get into this,
Well,
this space?
I started out as a home care doctor. So as a home care physician, you see how the family deals with the catastrophic conditions. So you have a bigger awareness about environment, about social and psychological aspects of medicine, and because of that, contributing to policy making and research as well as training. So a bit broader in my knowledge now. Yeah.
Wow. We mentioned a little bit earlier, but beyond services, how much of aging well comes down to community connection?
Okay. So I mentioned just now people, process, places, and infrastructure. So services is actually part of the processes. You have to make it accessible, affordable, of enough quality, and so on. So that's the process. But the people, I mean, is a community respectful and treasure their seniors? Or do they think that, oh, your seniors, you must be dirty and poor and disabled. Please don't build a nursing home near my house. Things like that, not in my backyard. So the community needs to be a bit more enlightened. Consider aging really as part of life. All of us are really in it together. So that's the people sector, a bit more friendly. So that's the people process. And then places. Places would be your housing design, your built environment around the housing, your facilities, the police posts, accessibility to the banks, and so on. And finally, the infrastructure. So how you build all this together. And then and the neighborhood, the school. So you want to have the whole community integrated together across generation, across of course racial, religious, and all these divides. Then this really is really age friendly if we plan it like this.
Okay. And what role do families play, especially as we think about our own future?
Maybe the biggest role, if you ask most seniors, what do they, even if you ask them, what do you mean by health? Like, you think health is the most important, right? We did that research before in one poll. Many seniors say health is able to cook for my family. Health is able to contribute to my family and hang out with my grandchildren. So well, simple folks, we regard the meaning of life as relationships. So I think it's really central. So family is central. But of course, there are people without family in the traditional sense. They're not married, no kids. There's this understanding that there's this thing called the family of choice, whereby it's a group of friends, your family. So relationships, is really important to human existence. Yeah. And a lot of things that the doctors can't help, you can only help so much, but the biggest bulk of the help comes from the family. Yeah.
Dr. Ng, before we wrap up, when you think about aging well, what does it mean for you personally? At the heart of all this invaluable insights you've given us, what does it mean to you personally?
Well, to me, there are 5 things. Physical health, security. In Singapore, we don't have to worry about disasters, so it's really about income security. And then the third thing I would think is relationships and participation. The fourth one is lifelong learning, because as you grow older and older, sometimes you really need to feel that everything is part of your growth and development. Otherwise, it can be really difficult. And the last part, I call it resilience. It's about, life sometimes throw you curveballs, and then when you're down, what help you keep you going. So that part is a very important part of aging, because as you age, you may not expect it, but you may just have a fall, and you cannot believe that you have a fall, and it can be really difficult. So you need that resilience in inner strength. So these are the 5 things I feel are important for aging well.
Wow, powerful reminder. Aging well isn't just about, thinking about where we are staying, not the physical space. There's so many considerations, including resilience and lifelong learning, as you mentioned, family support, and also being in communities where people can just grow old with dignity, joy, and connection.
Yeah, yes, indeed. Well said.
Thank you so much, Dr. Ng. It's been a real pleasure speaking with you.
Thank you, Lynlee.
He is Dr. Ng Wai Chong, CEO of NWC Longevity Practice and Director of Clinical Development at the Home Nursing Foundation. You've been listening to Viewpoint on the Afternoon Update. Stay tuned to Money FM 89.3.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.